Hi, I'm Mike Fraser. I'm the Executive Director of the Association of State and Territorial Health Officials, and I'm here with Dr. Mark Levine, who's the Commissioner of Health in the state of Vermont. And recently, Dr. Levine worked on a case study, which is in the Journal of Public Health Management and Practice, on the issue of firearm safety. Mark, thanks for talking with me today and sharing a little bit about this case study with readers. Gun violence, firearm safety, it's a third rail. How did you approach this from a public health perspective?
Yeah, so I hate to say I was fortunate by the fact that we actually had a near-miss incident in Vermont, but that's sometimes what it takes to galvanize a state and galvanize a governor and legislature. And even in states that have had actual experiences, we know how challenging that process can be. But we had a near-miss incident. When the governor saw the affidavit from law enforcement, he, in a widely quoted phrase, said, "I'm jolted." And he was truly jolted by it. Third rail was a correct characterization. No real legislator or anyone in elective office had raised doing anything about guns as part of any platform traditionally in Vermont. Part of that is because we have a pretty safe state, and there hadn't been much going on with regards to adverse impact that firearms were having on the population. But nonetheless, this really created a situation where the conversations could begin, which was really important.
So your governor was jolted by the reality that there could have been a school shooting in Vermont, and
exactly.
Did he come to you as public health director, or how did that go down?
No, actually, he didn't come to me immediately at all. I'm not sure he even viewed public health lens of firearm safety. I'm not sure many people in elected office do that really. They consider it much more a public safety issue, and they have plenty of people in their administrations who can deal with the public safety aspects.
Right. So you are internal medicine physician.
Yep.
And now you're the physician, basically the physician for Vermont. So your state, your patient is the state. And how did you think about firearm safety as a disease? I mean, what kind of frame did you bring to it?
Yeah. No, that's a great question. Because within the health department, this had been an interest of ours. As most health departments do, we have an injury prevention section, not heavily staffed, and the CDC will admit to the fact that there's not a lot of funding for those kind of positions around the country. But nonetheless, we've traditionally kept data and statistics on firearm injuries, firearm deaths, deaths by homicide, deaths by suicide. So we, as is our tradition in public health, we had a trove of data to work with. We do always want to play our traditional role as health promotion and education about important issues. So we saw this as a real opportunity to bring a lot of the aspirations we have had as a health department anyways in this issue to the governor's attention, and to just offer ourselves up as, here's data resource, here's an education and health promotion resource, here's a way to frame an issue in public health terms, which can be very useful as you frame the arguments for why you want this piece of legislation or that piece of legislation to pass.
Right. Great. The issue seems like it's impossible to solve in this country. It's just so political. But what you talk about in your case study is how to get some stuff done.
Yeah.
And I think that that's a wonderful opportunity for public health leadership. So kudos to you for writing this up. One piece of advice you would give to public health leaders that want to take this issue on from a public health approach?
Sure. Be courageous. I consider my governor one of the most courageous people I know, because getting out in front of the cameras and working against a crowd who's crying at you that you're taking their individual liberties away, and breaking your promises to them takes a lot of courage. And thinking of the population's health as opposed to one person's right to have a gun, even though he wasn't taking anyone's guns away, nor was the legislature by this legislation. So be as courageous as the governor, and I felt we as a health department had to be courageous and try to be out in front without necessarily being out in front in the media, out in front in terms of advocating for the issue, but being a branch of state government that could support our governor and legislature in trying to do the right things about an issue that impacts the population's health.
Right. Well, it's a great case study. It is a case study of courage. It's a case study of using evidence. And it's a case study of public health leadership. So take a look at the Journal of Public Health Management and Practice. Should be forthcoming soon. Thanks for talking with us about this, Dr. Levine, and thanks to everybody for watching.
Thank you.